Hi, I'm Neil Chiritra, Director of NTC Architects, and I'm here with Nick Bournes, Director of NH Architecture. Firstly, we'd like to acknowledge the Wurundjeri people as the traditional owners of the country where this project is located. This project delivers gold standard mental health outcomes for consumers and is in response to the Royal Commission into Victoria's mental health system. The project is one of 4 projects delivered under the $492 million mental health beds expansion program for our client, the Victorian Health Building Authority. This project, we delivered 120 new acute mental health beds at Sunshine, Northern, Royal Melbourne Hospitals and McKellar Centre down in Geelong. These images of existing mental health facilities are part of what the Royal Commission want addressed. Lifeless courtyards, high containment fences, internalised dark spaces, limited views to the outside, and it looks and feels institutional. Our key architectural solutions are a co-design process which integrated people with lived experience, salutogenic and biophilic design approach, access to daylight, spatial legibility and familiar and domestic. And more granular design strands are the design for gender safety, designing for wellness, providing consumer autonomy, design to minimise self-harm, high amenity landscapes, and design for robustness. The old model of the mental health facilities is an octagon, which is similar to prisons where consumers have very little privacy and the accessible courtyards are external to the building, which then requires high containment fences. Our new model internalises those accessible courtyards and creates the building as the boundary, which mitigates the need for tall containment fences and also maximises all the daylight into the occupiable spaces and provides immediate access for consumers to move out into the landscape. Our collaborative and integrated co-design process with people with lived experience ensure that the project delivers evidence-based designs that are recovery-focused and promotes well-being for all occupants. The bedroom and ensuites are critical parts of the building, as these are the only spaces where consumers are left unattended and where most of the self-harm can occur. We built a full-scale modular prototype, which was inspected and rigorously tested by all stakeholders. To minimise the leakage opportunities, there could not be a hole or a gap greater than 2 millimetres. The building's design is a 52-bed unit over 2 floors and constructed from 330 steel modules. We created a new acute front door for the hospital, a mental health precinct, deliberately separate from the existing hospital front door. The project also created a dedicated linkway between the facility and the emergency department.
Thanks, Neil. I've got to say there's something therapeutic about trying to destroy a room as part of your architectural commission.
Yes.
The project really grapples with the idea of how do you destigmatise mental health services? How do you bring them to a front door? How do you make them something that feels civic rather than institutional? Something that feels of place and generous rather than institutional? Something that feels like something you might go and stay in a form of accommodation rather than a prison. One of the key elements of this project was to think about the place in which it's formed in the Western Plains. Think about creating a calming yet referential treatment within a very loud hospital environment, some fairly loud architecture that exists around this building. And we started thinking about the mudflats and the flats of Melbourne. How do you start to bring those into this system? So creating an expressive facade that needs to deal with a very large scale, breaking it down through the use of bricks. So we did a complete brick pattern documentation of all the different brick patterns to create a subtle coloration of the idea of the Melbourne's geography through the building, creating a texture facade that starts to deal with the idea of scale and human aspects of the planting and other planting, and talks about the colorations of that place. We also looked at the idea of the windows and how to dematerialise the actual cellular nature of those by creating the hoods and scaling devices that start to talk about how do you make this very tall building start to feel a little bit shorter on the horizon by actually overscaling some of the elements. How do you start to think about scale and proportion as something that talks about a generosity to those that are within it, rather than it being something that's only doing what's minimal? How do we actually think about this as a citizen of the campus, starting to express the way you circulate through the building, the way people are occupying it, making it evident and legible to the outside? How do you bring joy into it, whilst also keeping it respectful? How do you show people looking at a light flashing along as someone walks past the corridor, the idea of occupation within? How can these elements then start to create this sort of beautiful juxtapositions of scale which are so human in nature rather than overall large and institutional? Can these materials start to then be something you start to identify with the idea of place. Another key element for us really was the access to light for all. And the idea that, as Neil said, by bringing the courtyard to the centre, all of a sudden you're no longer inside a deep institutional plate. You've actually always got access to light both from your bedroom, looking out, but also looking across through courtyard space, and for the first time in these institutions, having unfettered access to the outside world as you wish and when you wish. The challenge of that in a facility of this scale is how do we do it without making a huge pancake of a building? We stacked it up over 3 stories and used light to carve out where the courtyards were, creating really great solar access to all these courtyards. And then we used those courtyards to generate planning. So in fact, this is a reverse building where the health planning, for the first time I've done in my career, is actually planned around the amenity rather than the amenity shoved from the side of the health planning. Even down to the idea that perhaps some of these events can happen on the edge and not behind a big prison wall, but through a visual connection piece, and use the landscape, which will grow soon, I promise, to be a mediator. And you start to see how that planning actually radiates around those courtyards as terraces.
On both levels, the bedrooms are predominantly positioned to the north with views to nature, and each pod is clustered around one of those 4-step courtyards that Nick mentioned. The Royal Commission also recommended smaller cohorting of consumers rather than the traditional large cohorting of consumers. By the planning, we created a sort of share house type environment with a backyard and smaller living and dining spaces. As mentioned, spatial legibility was important. Providing consumers the ability to understand where they are within the building helps reduce anxiety. Oops, go back one. The courtyards and artwork are 2 devices that support this. There are 27 custom integrated pieces of artwork that help the consumer know their place within the building. The courtyards are excellent devices to provide visual connections to all the adjacent spaces and the long view through the building. Thank you.
With 1 minute to go. This is still obviously an acute hospital. It has all the challenges with that. So we know we haven't made any houses. What we've made here is something familiar and domestic, with materials that speak to something you might want to see in your home, something you see in environments outside of a hospital. So they're hospitality in nature, with views to gardens being brought in, with timber materials, and it's not moving. And even the way that in some ways, you don't put that material everywhere. You create spaces which people go to that are warmer and smaller, right down to the light dots you see, which speak about a hospitality venue, but they also change with circadian rhythm. Having these spaces on the external edge of the building means, again, it's familiar to sit in the window rather than sit in the centre of a very deep plan. So we'll leave you with this slide. This is actually the ambulance bay, which is where most people's journey starts. And one of the feedback we did when we spoke to the consumers, one of the biggest traumas for them is actually arriving in an ambulance bay. So the idea you arrive, and this space speaks of already how we intend to care for you. It's a place to get well rather than a place to be sick.